Hey everyone, and welcome back to the channel. Today, we're diving into a really important topic that affects millions of people. High blood pressure. Managing hypertension is crucial for your long-term health, helping to prevent serious issues like heart attacks and strokes. Many of you are proactive about your health and take supplements, which is great. But did you know that some supplements can actually interfere with your blood pressure or the medications you take for it? It's true. So, we're going to break down 5 common supplements you should be cautious about if you have high blood pressure. As always, this is for informational purposes, and you should always talk to your doctor before making any changes to your health routine. Let's start with a really popular one. Vitamin D. We know vitamin D is essential for things like bone health and reducing inflammation. Our bodies even make it from sunlight. Some studies have suggested that certain doses of vitamin D might even help lower blood pressure. However, the key word here is doses. Extremely high doses, we're talking over 10,000 international units per day, can lead to a condition called hypercalcemia, which is when you have too much calcium in your blood. Over time, hypercalcemia can actually cause high blood pressure. Plus, if you're taking certain diuretics or water pills, high-dose vitamin D can interfere with them, causing your body to retain too much calcium. This can raise your calcium levels and potentially your blood pressure. So, what's the takeaway? Don't just start megadosing vitamin D. Ask your doctor to check your levels. They can tell you if you actually need a supplement and what dose is safe and effective for you. Next on our list is licorice root. You might see this used as a flavoring in candies, teas, and other products. In traditional medicine, it's been used for various ailments. The problem lies with a compound in licorice called glyceric acid, or GA. This specific ingredient can raise your blood pressure, even in small amounts. Studies have shown that as little as 100 milligrams of GA daily can have this effect. If you have high blood pressure, this is a real concern. What's more, licorice root can interact with blood pressure medications, especially diuretics. It can cause your body to hold on to sodium and lose potassium. When combined with a diuretic that also affects potassium, your levels could drop to a dangerously low point. So, if you're managing hypertension, it's probably best to avoid supplements and products that contain licorice root. Always check the labels. Moving on to number 3. St. John's Wort. This is a well-known herbal supplement, often used for symptoms of depression or menopause. While it might have its uses, St. John's Wort is famous for one big reason. It interacts with a huge number of medications. And yes, that includes some common blood pressure drugs. It can make medications like nefidopin, tylenol, and verapamil less effective. How? It seems to interfere with how your body absorbs the medication, meaning you don't get the full, intended dose. This could leave your blood pressure uncontrolled, which is exactly what you're trying to avoid. The list of drugs that St. John's Wort interacts with is long, so if you're considering taking it for any reason, it is absolutely essential to have a conversation with your healthcare provider or pharmacist first. They can review all your current medications and tell you if it's safe. Number 4 might surprise you. Arnica. Arnica is a flower, and you've probably seen it in creams and gels for bruises, swelling, and muscle soreness. When used on the skin, it's generally considered safe. However, taking Arnica by mouth is a completely different story. Experts strongly advise against it because it can be toxic and cause some serious side effects. Among these side effects is, you guessed it, high blood pressure. But it doesn't stop there. Taking Arnica orally can also lead to an increased heart rate, vomiting, diarrhea, and even damage to your heart and other vital organs. So, the rule with Arnica is simple. Keep it on the outside of your body. If you see Arnica listed as an ingredient in a pill or tincture meant to be swallowed, steer clear, especially if you have high blood pressure. Finally, let's talk about bitter orange. You might find this supplement marketed for weight loss or to boost athletic performance. The active ingredient in bitter orange is a stimulant called potassium. Now, this compound is chemically similar to ephedrine, a substance that the FDA banned in dietary supplements because of its risks, including heart attack and stroke. While bitter orange isn't banned, it needs to be used with extreme caution. Studies have clearly shown that supplements containing bitter orange can raise both your blood pressure and your heart rate. This significantly increases your risk for serious cardiovascular events, the very things people with high blood pressure are trying to prevent. It's worth noting that the small amounts of bitter orange used for flavoring in foods and drinks are unlikely to cause these problems. But when it comes to the concentrated supplements, the risk is real. Again, a conversation with your doctor is a must before even considering this one. So there you have it. 5 supplements to be cautious with if you have high blood pressure: high-dose vitamin D, licorice root, St. John's wort, oral arnica, and bitter orange. The big lesson here is that natural doesn't always mean safe, especially when you have an underlying health condition or are taking medication. Everyone's body is different, and how you react to a supplement can depend on your genetics, your diet, and your overall health. The best case scenario is that a supplement doesn't work. The worst case is that it causes harm. That's why it's so important to be an informed and proactive patient. Before you start any new vitamin, herb, or supplement, please have a chat with your doctor or pharmacist. They can help you weigh the pros and cons, check for any potential interactions with your current medications, and ensure you're making the safest choice for your health. Thank you so much for watching today. I hope you found this information helpful. If you did, please give this video a thumbs up and consider subscribing for more health content. Stay safe, stay informed, and we'll see you in the next video.